Hey, good day. My name is Al Daven, a student from Liceo de Cagayan University, School of Graduate Studies, taking up my master's in nursing, major in surgical nursing. In this video, I'm going to present to you a result from a research study. But before that, let me ask you, have you been sick? Have you been to a hospital? Or were you admitted lately or recently or in the past month, year? Let me ask you, who attend most of your needs? Giving your medication, taking your vital signs. Of course, they are nurses. Nurses are healthcare professionals that play a very significant role in providing care and giving healthcare needs among patients. And in spite of their roles and responsibilities, human as they are being stressed or burnout. So what is burnout? It is an emotional condition marked by tiredness, loss of interest or frustration that interferes with job performance as a result of prolonged stress. It is also a mental or physical energy depletion after a period of chronic, unrelieved job stress. It is for this reason that this study has been conducted. This is to determine their level of burnout. So, in this presentation, we are going to deal with the demographic profile of the nurses in terms of job satisfaction level, their burnout level, and their work performance evaluation. Specifically, we will be dealing with these variables. First, job satisfaction level. Is it low, average, or high? Second, burnout level, from no stress to dangerous amount of stress. Third, for work performance evaluation, is it very satisfied, satisfied, fairly satisfied, and poor? And also, we will be dealing also with life satisfaction level. Another variable that we'll be dealing with is the respondents or the nurses' burnout level in terms of job burnout and emotional exhaustion. And last, we are going to answer if there is a significant relationship between the respondents' burnout level, job burnout and emotional exhaustion, and life satisfaction level. In this figure, you can see the distribution of the respondents according to job satisfaction level. This data shows that most or 38% of the nurses has an average level of job satisfaction. And according to Masuba, in 2015, people who are satisfied with their jobs tend to perform better. According to Husami in 2008, other issues may relate to job satisfaction of nurses are organizational commitment, organizational support, such as unfair work condition, salary inequities, and lack of employment support. And according to Reddy in 2015, in her study among nurses in India, he identified that most of the nurses are neutral about their job satisfaction level. Now, when talking about burnout level, as shown in this figure, data shows that among nurses in terms of job burnout and emotional exhaustion, data shows that most or 49% of nurses has a high amount of job-related stress in terms of job burnout, and in emotional exhaustion is 57%. According to Lee, in 1996, that nurses with high level of trust and support decreases the emotional exhaustion and burnout phase. Now, in terms of performance or work performance evaluation, most or 35% of the nurses has a poor level of evaluation, while 3% has a fair level of workplace performance, as shown in this figure. According to Lu, in 2011, nurses who are exposed in ward has a poor level of evaluation. Work performance is affected by condition and organizational environment, job stress, role conflict and ambiguity, role perception, and role content. Organizational and professional commitment can also be a contributing factor. In this figure, it shows the distribution of the nurses in life satisfaction level. Most of the nurses, or 47%, are fairly satisfied, while 10% of the nurses are very much satisfied. In a study conducted in Merhab in 2013, he identified that majority of the Iranian nurses are satisfied in life and men are higher level of satisfaction compared to women. In terms of burnout level, specifically in job burnout level, among the respondents or the nurses, an average of 74.1 standard deviation is equivalent to 18.1, whereas in emotional exhaustion level, for the same group average of 73.9 with standard deviation of 16.5, which implies that job burnout or burnout level among nurses in terms of job is higher compared to emotional exhaustion. However, in a study conducted by Icahn in 2002, nurses who care more about patients experience or exhibit high emotional exhaustion. And a study in Michigan by Hoffman in 2003, he identified that nurses who work 12-hour shift experience significant high amount of job-related stress. Now, let's talk about the significant difference among nurses on job burnout and emotional exhaustion according to job satisfaction level, as you can see in the table. Significant value is in terms of job burnout is equivalent to 0.126, which means that there is a significant. Therefore, the null hypothesis should be rejected. On the other hand, when it comes to emotional exhaustion, the significant value is equivalent to 0.137. This implies that there is a significance of the nurses' burnout level when they are grouped according to their life satisfaction level. This confirms the study of Ramasudi in 2010 that when nurses have high level of job satisfaction, it is less likely they are being burned out or they experience burnout. Now, let's talk about the nurses' burnout level and their life satisfaction level. When asked about the significant difference of nurses on job burnout and life satisfaction, data shows that the significant value is equivalent to 0.000, which implies that there is a significant difference. The correlation coefficient of the determinant is equivalent to 0.966, which is a strong negative association, which implies that 93% can be explained that job burnout is affected by life satisfaction level and 7% can be explained by other factors such as organizational support, leadership, behavior. This is according to Sami in 2008. This can also be explained by this figure. Let's talk about the significant difference of the nurses' emotional exhaustion and life satisfaction. Data shows that the significant value is equivalent to 0.00, which also implies that there is no significant difference. the correlation coefficient of determinant is equivalent to 0.952, which is a strong negative association that implies that 90% can be explained that emotional exhaustion is affected by life satisfaction level among nurses. On the other hand, 10% can be explained by other factors such as mental challenging work, relationship from colleague, and working condition. This is according to Luke in his study in 2009. This result can also be explained by this figure. And there you have it. Nurses' burnout level, life satisfaction level, and work performance evaluation. Thank you very much for watching.